No, we're live. Hey, good afternoon, everyone. Thank you for being here. My name is Dr. Michelle Morse. I'm the acting New York City Health Commissioner and Chief Medical Officer. I am joined by our Deputy Chief Medical Officer, Dr. Tony Esseline, to my right, and our Director of Respiratory Pathogens, Dr. Ellen Lee, to my left. It is peak flu season, and as many of you know, New York City is experiencing very high rates of flu. Flu cases have been unusually high across the United States this year as well. And against that backdrop, the federal government announced major revisions to the childhood vaccination schedule, including flu vaccinations. In light of that confluence of factors, we're holding this briefing to provide updates on the current respiratory viral season, and most importantly, to affirm the New York City Health Department's vaccine recommendations. This year's respiratory viral season arrived earlier than usual, with significant numbers of flu cases reported starting in October. With few exceptions, the numbers have steadily increased since then. For the week ending December 20th, there were more than 32,000 positive flu cases in New York City. That's the highest weekly total the health department has reported since 2005, which is the first year that flu was made reportable by New York State. As of the week ending January 3rd, more than 128,000 New Yorkers have tested positive for flu so far this season. This is far more than what was reported at this point in either of the past two flu seasons. Behind every data point, of course, is a New Yorker, our neighbors, our colleagues, our loved ones, and our friends. And while cases have been very high in the early months of this flu season, there is some good news. Over the last 2 weeks, cases have declined, but we're not out of the woods yet. Flu seasons are unpredictable, and the virus continues to circulate at very high levels. There were more than 12,000 cases reported last week. Roughly 1 in 3 were children under the age of 18. Flu season can extend into May, and other respiratory viruses like RSV and COVID are also circulating. This is not the time for New Yorkers to relax their efforts to protect themselves and their families and communities from these deadly viruses. The best tool we have for preventing severe illness is vaccination. And right now, the federal government is calling that tool into question. On Monday, Secretary Robert F. Kennedy Jr. announced an unprecedented overhaul of the Centers for Disease Control and Prevention's childhood vaccination schedule, which now recommends fewer immunizations for children for preventable infectious diseases. This includes upending the flu vaccine recommendation at a time when we are surging flu cases nationwide, and at a time in which 9 children nationwide have already died from flu this season. By the CDC's own estimation, the vaccination of children born between 1994 and 2023 will have prevented more than 500 million illnesses, helped avoid more than 1 million deaths, and saved nearly $2.7 trillion in societal costs. By significantly shrinking the list of recommended vaccines proven to save lives, the CDC is putting the health and well-being of children and their families at risk. As a part of that overhaul, the CDC is no longer recommending flu immunizations for all children. This could have deadly consequences nationwide. We reject that guidance. Let me be very clear. There's no evidence to support the change in federal recommendations, and vaccines remain safe, effective, and recommended to prevent serious illness. It's not too late for New Yorkers to receive their flu vaccine. While the current flu strain has developed mutations, the currently available updated flu shot has still been shown to prevent serious complications and hospitalizations. Last respiratory viral season set an unfortunate record for cases of pediatric flu deaths. 89% of children who were eligible to get the flu vaccine had not been vaccinated. I do not want New Yorkers to miss out on this life-saving tool. As New York City's doctor, it is important for New Yorkers to know our guidance has not changed. We continue to recommend that children receive all vaccines as previously recommended by the CDC. That means everyone, including our youngest New Yorkers 6 months and older, should get a flu vaccine. Thank you. I will now turn it over to my colleague, Dr. Esseline, for more information on how to stay healthy this winter.
Thank you, Dr. Morse. So as both the Deputy Chief Medical Officer at the Health Department and a practicing pediatrician in New York City, I echo that sentiment. Vaccination is the best tool we have for preventing serious illness. Parents, caregivers, and loved ones, I know how confusing this time must be when it comes to your child's health and vaccination schedule. But let me be clear, vaccinations are a prerequisite for health. Lately, I have been reiterating that to concerned parents who are seeking the best care for their children. I've cared personally for multiple children who have tested positive for the flu in the last couple of months. Most have been able to avoid the hospital, especially if they were vaccinated. And I'm also part of a generation of pediatricians that saw an illness called rotavirus wreak havoc in our communities. Entire floors were dedicated to taking care of these children, babies, for weeks. And now there are pediatricians who have never, ever seen this illness or even smelled it. It's the smell. That is the worst part of it. And so we cannot go back. That is a win. And we remain steadfast in our vaccine recommendations. I know I am by far not the only provider fielding questions from confused parents and caregivers lately, and it is important that we are all equipped with clear answers. In response to the CDC's revised childhood vaccine schedule, we coordinated with New York State officials to send clear guidance to healthcare providers yesterday through the statewide Health Advisory Network. Despite all of the confusion at the federal level, our recommendations have not changed. They remain clear, they remain consistent. Everyone 6 months and older should get vaccinated for COVID-19 and the flu, even if they have previously been vaccinated or gotten sick. These are annual vaccines, and each year provides new protection. The RSV vaccine, on the other hand, is a one-time vaccination, one and done. Older adults and pregnant people should get the RSV vaccine if they have not yet received it. It is not too late to get your shots, and you can find a vaccination site near you at nyc.gov/healthmap or by calling 311 for assistance. As Dr. Morse said, this year's flu strain developed mutations that make it stronger than most. However, preliminary research from countries with early flu seasons found that this year's flu vaccine was still effective at keeping people out of the hospital. That was particularly true in children and adolescents. The flu vaccine prevented between 72 and 75% of hospital admissions for people under the age of 18 years old. Ultimately, vaccines provide important protection against serious illness. That does not mean that we may not get infected. It means we may be able to avoid the hospital. Again, while we are seeing a decline in flu cases in New York City, which is encouraging, the virus is still circulating at high levels. And New Yorkers must remain vigilant. COVID-19, flu, and RSV are common throughout the fall and winter months, and they are contagious. Respiratory viruses are spread mainly by droplets produced when someone who is sick coughs, sneezes, talks, or breathes. New Yorkers, each one of you can help us by adhering to our guidance as New York City's lead doctors and putting your health first. We know people's individual choices impact our city's collective health. And so if you are feeling sick, listen up, please cover your coughs and sneezes, wear a mask around others, wash your hands as often as you can, sanitize those surfaces, and most importantly, stay home if you are able. Not everybody's able to, but if you can, take advantage of that opportunity. And if your symptoms do not improve, please talk to your healthcare provider or visit an urgent care. This winter, take care of yourselves and take care of each other. Each of us must do our part to stay healthy. And again, getting vaccinated and staying home when you're sick, again, if you're able, not everybody can, are acts of care for yourself and your community. Thank you.
Thank you, Dr. Esseline. So we're happy to take some questions.
We're going to do some on-topic questions starting in the room. Okay. Dr. Morris, can you better characterize what sounds like good news, which is that cases have declined the last 2 weeks? How can we assess whether New York City has hit its peak of flu cases?
So phenomenal place to start. What we're here to say is that is encouraging to have seen some decreases over the past 2 weeks. And at the same time, we are not out of the woods. So flu is notoriously a bit unpredictable. We fully expect, actually, that over the next several weeks, we'll continue to see flu cases continuing. We are too early in the season to say whether or not we have passed our peak. And flu season typically lasts, as I mentioned, until May. So this is a marker in time to say that flu just a couple of weeks ago was at the highest number of cases we've had in over 20 years, and it is still circulating at high levels. And New Yorkers should go ahead and get the flu vaccine now if they haven't gotten it, because the data does suggest that vaccine, despite the mutation and subclade K, is very effective at keeping you out of the hospital or worse.
Crystal?
I think I'm not sure. Can you clarify just how many have been vaccinated so far this season? Are we seeing vaccination rates drop compared to other years?
This is a really important point. We have seen a decrease in the number of people who've gotten the flu vaccine, and I'm going to ask my colleague, Dr. Lee, to give those specific numbers.
Thank you so much, Dr. Morse. So what we know is for the this current influenza season, we've had over 500,000 flu vaccine doses that have been administered to children aged 6 months to 18 years old. This is almost a 6% decline compared to the number of doses that were administered to the same age group during the same period of time in the most recent 24 to 25 respiratory season. And currently, the influenza vaccine coverage among children aged 6 months to 18 years old is 30.6%.
Is that decline in adults also, or only?
Unfortunately, we do not get consistently vaccination information from adults. It's not mandated, so we have that only for children.
You addressed the confusion coming from the federal level to some of your patients and parents. Can you talk to me about how this federal guidance is not impacting the law here in New York City, U.S. practice?
Yes, thank you for asking for that clarification. So the recommendations from the CDC are that they're recommendations, but the requirements around vaccination for school and otherwise are determined by local law. So here in New York City, as well as at New York State, we have laws on the books and guidance on the books about what is recommended. And then there are specific requirements for entry into childcare, for example, daycare, and for school as well. Those are also determined locally, and those have not changed. And as Dr. Esseline was mentioning, we did release, in partnership with Dr. McDonald and the State Health Department yesterday, a advisory to all providers across the whole entire state and city that specifically described that those requirements have not changed, the laws have not changed locally. And so we really want to make sure that everyone knows in New York City, nothing has changed.
Hi, Dr. Morris. I wanted to know if you've briefed Mayor Montgomery on this and if you're planning any specific actions to try and increase, especially pediatric vaccination rates, especially knowing that you might be having nurses strike next week and hospital officials are sounding the alarm about potentially much less hospital capacity for this.
We have had some really important conversations with our new Deputy Mayor, Helen Artiga, and are making sure that all of our colleagues and new colleagues, exciting new colleagues at City Hall, have all the information they need about what's happening. One of the things that we've done this season that was different than last season also is that we actually have a respiratory viral page that has all of the information, not just for everyone in city government, but for all New Yorkers to take a look at and see what the numbers are looking like. So we believe that that kind of transparency is incredibly important. And so, yes, all of this information is being circulated to the right people within city government. And we're really, we wanted to make sure that we had this conversation to make sure that the message is clear to the public about what's happening currently in New York City.
An estimate for how many hospitals?
Thank you for the question. So we do typically see anywhere, unfortunately, between 1,500 and 2,000 deaths from flu and influenza each year. We do not yet have that information for this flu season, but I would like Dr. Lee to just share a little bit more.
Sure. Thank you so much, Dr. Morrison. Thank you for that question. The information for mortality related to flu, it typically comes later on in the season when we're able to collect information from death certificates. So we do not have those data yet. We also do individual investigations for any potential case of a child who dies of flu. At this time, we do not have any confirmed cases of pediatric influenza-related death.
Morse, there's obviously a new deputy mayor. She's going to be overseeing services, and what that means for your position now. This might be something I think we get a time and co-medical sector with the flu vaccine. Okay. Sorry. I'm sorry.
Hi, doctors. I'm just curious about your prediction to this flu. Will the vaccine patients because of like unpredictable risks for this type?
Yeah, this is a very important question. Each year, there is a very extensive technical and complex process for matching or predicting which flu strains are going to be circulating and then trying to match the flu vaccine to those circulating strains. It does require a lot of time and a lot of really important thought from scientists and folks like Dr. Lee. And so even though this subclade K emerged over the summer after the vaccine for this flu season had already kind of been constituted and determined and manufactured, what is most important to know is that that updated flu shot is still very important and protective. And data from other countries like the UK that Dr. Esseline referenced shows that it is still really effective at keeping people out of the hospital. So that's the most important part of the message. It's still too early in the flu season to know exactly what the vaccine effectiveness is going to be. And again, we are not out of the woods. Flu is circulating at very high levels right now in New York City, and flu seasons are unpredictable. So it's not going to be really until several months from now that we're going to have a better answer to that question.
Let's take a couple questions virtually. We'll try to get that right. Are we done?
Yeah. Hi, I'm Becca from and we've been speaking to, thanks for speaking with us today. We've been speaking with local pediatricians who have already been hearing a lot of misinformation and confusion, including, you know, after the new federal vaccination guidelines, which puts the flu vaccine for children at a shared clinical decision making. People don't know what that means. Can you guys elucidate that? And what will the city be doing to help counter some of this misinformation and confusion from parents?
Thank you for that question. I'll just mention one thing that we're doing right now, and I'll ask Dr. Esseline to share a little more about the shared clinical decision-making confusion. And I forgot to answer that part of Maya's question from earlier. So one of the most important things that we are doing right now to make sure that every New Yorker who's eligible gets the updated flu vaccine, COVID vaccine, and all the childhood vaccinations, is that we launched a campaign called Don't Miss Out. We've invested over $1 million in that campaign. That campaign is running currently on news, radio, television, and other different outlets of media to make sure that New Yorkers know what the consequences are of not getting vaccinated, and encouraging people to remember that this is something that it's worth making the time to do, and in fact is life-saving. So that's one of the many ways that we're trying to make sure New Yorkers have the information they need to keep themselves, their family, and their community safe with vaccination this season.
Yeah, and what I can add about shared decision making is what is supposed to be happening between your provider at all times. There's always shared decision making. And so I think that instead of focusing on the confusion, one of the things that we know is that our community members trust our pediatricians. They trust our providers. And so we need to make sure that our providers understand that nothing has changed. We are still doing things the way that we were always doing them, and that the best decision for the patients that are in front of you, the people that are in front of you, the individuals that you're caring for, is to give them the tools to protect themselves from preventable disease and illness that can get really severe and land you in the hospital. And so for anyone who's trying to understand what shared decision making is the process of communicating with your physician about what are the next things that are best for you to take care of yourself.
And if I may just add, from the perspective of looking at pediatric flu cases, and particularly those children who have passed away due to flu, it is a remarkably high proportion who could have gotten the vaccine, but who did not, and then ended up dying of flu. So it is painful to see these cases. And when you look at the numbers, it's almost 90% of children who died could have gotten the vaccine who didn't. This is both within our own city as well as nationwide. The data is fairly consistent.
Time for just a couple more. Hi, Dr. Morris. What is the health department doing to ensure that the childhood vaccination rate is rising when right now we said it's decreasing, but we still have, you said a record number of flu cases?
This is one of our great challenges in public health right now. It's part of the reason that we are having this press briefing. We know that first of all, what we know is that families go to their pediatrician and trust their pediatrician. That advice from a pediatrician is incredibly effective. So we spend a lot of our time in the health department engaging with pediatricians, making sure that they have the fact sheets, the guidance, the information they need to be able to best counsel families as they're making decisions about vaccination. And we support them in many different ways. So that's kind of one way that we do that, because we know how powerful that recommendation is from a pediatrician. Another thing that we try our best to do a lot of course, is interviews, media, and making sure that when questions come up, or when something like this week, where we've seen some changes in our numbers happens, that we use the platforms that we have to communicate to the public, and media campaigns like our Don't Miss Out campaign is another way that we do that. The other thing that I would say is that we use data for action. And what we know is that we are hearing anecdotally already that there are a lot more questions that pediatricians, nurse practitioners, and others are hearing about vaccines. And so our partnership with them is about really saying, we want to support you to be able to have some of these harder conversations. It may take more time, but we know that we have to dedicate the time to making sure that families have all of their questions answered. And even if that takes more time, it is worth every single conversation, and every family member should have all their questions answered. The big challenge for us, of course, is that misinformation travels more quickly than accurate information. And so we're constantly using new tactics and new approaches and strategies to try to counteract that misinformation.
Thank you very much. That concludes it.